little ones, it's Dr. Sam Price. I'm your licensed naturopathic physician. I'm an expert in natural medicine. Through my #1 best-selling books, my concierge practice, my international 2-day wellness event called Vital, the Experience, my supplement line, my blogs, and my newsletter, I help you bridge conventional and alternative medicine to transform your illness into wellness. Today, I want to talk about kidney stones. They're super common. I know most people think, oh my gosh, that's awful, but it's more common than what you think. So I'm going to go through what are the symptoms, what are the causes, or some of the types of kidney stones, and then what would I do as a naturopathic physician to help you prevent and to treat the kidney stones. So let's get started. If you're joining the broadcast, please type in the chat so that I know that you're here so I can say hi and acknowledge you. All right, so the symptoms, you're definitely going to know when you're having a kidney stone, usually. If the stone is really, really small and you pass it, you might not know. But if it's large enough, trust me, you're going to know. So the #1 symptom is pain, pain, and more pain, okay? Everybody thinks that the pain is usually in the back, but there's 3 places you can have the pain. Well, more than 3 places. But it's in your back, your belly, or the sides. So back, belly, or sides. So those are where you're going to feel the pain. #2 is your urine. Your urine is a super duper sign that you're having a kidney stone. So #1, you could have burning pain while you're urinating. That's a tall tale symptom. You could have blood in your urine. You could actually see blood in your urine. A lot of times it's microscopic and you can't see the blood. It doesn't actually tint the urine. But if you're seeing it, that's a problem, guys, okay? And you need to go see your doctor. Another sign in the urine is that it's cloudy or it's smelly. That could be a sign of an infection or a kidney infection or a urinary tract infection, but it could be kidney stones as well, all right? So we've got pain, we've got urine stuff. Also with the urine, it's frequency. You're like constantly having to go to the bathroom. Also, if you're going to the bathroom and you're not getting it all out, it's like coming like drip, 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 drip. That could be that the stone is impeding the progress of you actually having an effectual voiding, okay? So we've got pain, that's in the back, the belly, or the sides. You've got burning pain when you're urinating, frequency or urgency, little bitty tinkles of urine, cloudy, smelly urine. What else did I say? That's it for urine. You've got nausea or vomiting. Yes, kidney stones can cause nausea and vomiting. And the reason why is that the kidneys share a nerve with your GI tract. So sometimes it hits that nerve and it causes an upset stomach, which causes nausea or vomiting with kidney stones. That's pretty severe and you're gonna wanna call your doctor at that point. Sweating is another symptom that you could experience with kidney stones, and fevers and chills. So fevers, chills, sweating, nausea, vomiting, all of that you need to go see your doctor right away, all right? So let's talk about some different types of kidney stones. These are the reasons why you're having it and the types of stones that they could possibly be. Calcium. Calcium is a big one with kidney stones. So there's calcium oxalate and then there's calcium phosphate, phosphate type of stones. So let's talk about calcium oxalate stones. So these are because the oxalate is too high. So oxalate is made from your liver automatically. It's also found in certain foods that we eat. But oxalate also can be increased with too much vitamin D. If you've had bypass surgery, you can increase your oxalates, or any kind of metabolic disorder can also increase your oxalate. So that will give you calcium oxalate stones. Another one is called calcium phosphate stones, and these are more common with your metabolic diseases like diabetes. So they're also associated with migraine headaches, or seizure medications can increase the calcium phosphate. So another thing with calcium that I wanted to mention to you guys is I do hair tissue mineral analysis. I think that minerals are really, really important for us to look at in our patients and with my patients specifically. So what I have found is that when their calcium is high to their magnesium, this usually shows that they're not metabolizing the calcium correctly or that there's a magnesium deficiency. When there's a magnesium deficiency, it automatically means that calcium can't do what it's supposed to do because those two minerals work together. And so the calcium comes out of solution or wherever it is, and it deposits in the urinary tract or the gallbladder. So a lot of times when I have a patient with a high calcium to magnesium mineral ratio, I'll see that they've had kidney stones in the past or they have an issue with forming stones, period. So think about that. If your doctor hasn't been able to figure out why you keep getting these stones, look at the hair tissue mineral analysis or get a mineral analysis done. So the second or the third type of stone that I want to talk about is called a struvite stone. It's actually derived from a urinary tract infection. So you get this as a result of having a urinary tract infection, and they come on quickly without any warning, and there's severe pain. Okay, so that's a struvite. You're not going to know that you're going to get it. It comes on quickly. But if you've got a urinary tract infection, you want to treat that pretty quickly so you don't develop these stones. If you're getting frequent urinary tract infections, then you're going to want to treat those constantly and quickly so you don't develop these stones. And I'm going to talk about that in a minute. The fourth one I want to talk about is a uric acid stone. And, you know, they used to say that kidney stones were a rich man's or a rich woman's type of disease because uric acid is really high when you're eating a lot of red meat or you're having beer and you're drinking a lot. It comes from dehydration, so you're not having enough liquids and you're dehydrating yourself, and alcohol can also dehydrate you. Or you're losing too much fluid. So if you're profusely sweating and you're not rehydrating yourself, you can get uric acid stones. Or if you have gout, and gout is caused by you've got too much meat, too much soda pop, that kind of stuff. We can talk about gout later. So gout, eating too much protein, losing too many fluids, and dehydration can cause uric acid type of stones. And then the other one is a hereditary stone. It's called a cystine stone. You probably will know, your doctor will test you for that. It produces cystinuria. All right, so let's go into the ND tips. So of course I'm going to talk about diet. So number one are the avoids. You're going to avoid leafy green vegetables, unfortunately. So this is only if you're having real issues with this. So not a lot of leafy green vegetables. You want to avoid wheat. That's that gluten part of it. Remember, I told you that the kidneys and the digestive tract share a nerve, right? So animal proteins, limit your animal proteins. Concord grapes. Weird, right? But Concord grapes, you need to avoid those if you're having kidney stone issues. Avoid coffee, specifically coffee, but it's caffeine in general, but coffee specifically kind of ramps up the calcium and the other stone production. So you want to try to avoid caffeine and soda pop. So those are the avoids. You want to increase your water intake. I say this all the time, hydration, hydration, hydration. So water will help to flush and detox your kidneys. So you need to increase your water intake. Also, if you add lemon juice, that helps to flush out the kidneys as well. Okay, so those are the dietary. So let's talk about the herbs. That's what everybody always wants to know about is the herbs. Hey, Dr. Tennille, thanks for joining. So we're going to talk about herbs for kidney health. So I have 4 that I use in a protocol that I use for patients that have kidney stones. So the 4 that I use is an herbal combination called Stonebreaker. Stonebreaker is the active constituent or the main herb in the formula. There's some other ones, but Stonebreaker is actually called Chanca piedra, and it's from South American rainforest. And really from the Amazon. So the Amazonians, is that what you call them? Amazonians? I'm not really sure. But they use it with their people specifically to help prevent and deter the stones. So it's not for an acute situation. This actually helps to prevent the stones. Number 2 is I like to use a cocktail for kidney detox. So you want to detox the kidneys. So if you're constantly making like struvite stones or you're constantly getting the calcium that's building up inside the kidneys and places like that, I want to constantly detox the kidneys. The kidneys are used as a filtration system. So we want to make sure that they're clear and that they can process the toxins the way we want to. So one of the ones that I use has cordyceps, which is a mushroom, and also some B vitamins that we know are really great for the kidney. Number 3 is I like Khella. I think that's how you pronounce it. It's Khella. It's an herb in the carrot family, all right? And it's ancient. The ancient Egyptians used this. This is like the first recorded use of Khella. Is an ancient Egyptian used it for specifically urinary tract infections and kidney stones specifically. So Khella, Khella. The other one that I like is horse chestnut. Now, horse chestnut is actually a tree. It's most widely used for varicose veins or to help the veins actually take the blood from the body to the heart for increasing circulation specifically in the veins. But it is also used in Turkish culture. They use the seeds as a tea specifically for an upset stomach and also to help pass kidney stones. So it's like an off-label use, I guess, but I use horse chestnut specifically when someone's dealing with kidney stones and we need to help them pass the stones, okay? So number 1 is stone breaker, specifically chanca piedra. A kidney detox is necessary, Khella, which is going to help for urinary tract infections and stones, and then horse chestnut for passing the stones. So that is my talk today. I hope you guys enjoyed it. I'm Dr. Sam Price. I'm a licensed naturopathic physician. I'm an expert in natural medicine. Through my number 1 best-selling books, my concierge medical practice, my international wellness retreat, Vital D Experience, my blogs, my newsletters, and my Facebook Lives right here, I help you transform your illness into wellness by balancing traditional, conventional medicine and alternative medicine. I hope you've enjoyed this. Follow me on all social media at Dr. SamMD. That's DrSammND on all social media. And you can get more information on my website at all times at www.drsammnd.com. That's www.drsammnd.com. Talk to you later. Bye.